Are you a candidate for an artificial cervical disc? Before I help you answer that question, I'm going to briefly review the anatomy of the cervical spine. The cervical spine is composed of 7 vertebral bodies. Each bone looks like a box in the front, and in the back you have the small joints that interconnect to the bones above and below. Each vertebral body is separated from the other vertebral body by a disc. At each disc level, a nerve is given off, and all of these nerves join together in the axilla to form a larger nerve known as the brachial plexus. If a nerve is compressed in the cervical spine, that is going to cause pain to radiate down the upper extremity. That is known as radiculopathy. You can have pain, numbness, tingling, or weakness. If an individual has failed conservative treatment and surgery is indicated, in most cases, the best results come from those surgical procedures that involve completely removing the damaged disc. The surgeon will make a small incision on the front of the neck, the damaged disc is removed, and the bones are separated. Separating the bones gives the nerve more space, and also the associated bone spurs are removed at the same time. The space created by the removal of the disc and separating the bones must be filled with something, otherwise the bones will reapproximate and the nerves will be compressed once again. Classically, the space has been filled with cadaver bone, the patient's own bone, metal spacers, plastic spacers, or even metal mesh. All of these devices result in a cervical fusion. With a fusion, additional stress is placed at the adjacent levels, which will subsequently wear out quicker and may result in the need for surgery at the adjacent levels. An artificial cervical disc allows the patient to regain or maintain motion. An artificial disc is composed of 2 pieces of metal sandwiching a piece of polyethylene. The outer surfaces of the metal are coated in order to allow for bony ingrowth. How does the surgeon decide if you are a good candidate for an artificial cervical disc? Initially, the surgeon will review your x-rays to determine the amount of arthritis you have at the involved level, paying particular attention to the facet joints on the back of the neck. When the height of a collapsed disc is restored, as well as the motion to that level, the motion to the small facet joints in the back is also restored. If those joints have arthritis, the additional motion and stress will result in pain at that level, and you won't be happy with the artificial cervical disc. The best candidates for an artificial cervical disc are those individuals that have a cervical disc herniation that has failed conservative treatment and have very little underlying arthritis. What are some other conditions that might indicate you would be a better candidate for an anterior cervical decompression and fusion as opposed to a total disc arthroplasty? If you would need more than 2 artificial cervical discs, if you have cervical instability, if you are allergic to the materials that make up the artificial disc, such as titanium, polyethylene, cobalt, chromium, or any of the other elements, deformities of the vertebral body, either post-traumatic or congenital, which would make the placement of an artificial disc difficult, osteoporosis, prior surgery, if you are having surgery for a malignancy in the cervical spine, certain metabolic diseases such as Paget's disease or osteomalacia don't respond well to total disc arthroplasties. If you are pregnant or planning on becoming pregnant in the next 3 years, if you take certain medications, you may not be a candidate for a total disc arthroplasty, such as high-dose steroid medications. And finally, certain autoimmune conditions, such as rheumatoid arthritis, many times do not respond well to total disc arthroplasties. Overall, the results with an artificial cervical disc are amazing. The surgery takes about an hour. Typically, it's done as an outpatient. You don't have to wear a cervical collar. Back to normal activities within a few days, and back to strenuous activities within 6 to 8 weeks. I hope you found this video informative. If you have any other additional questions, please write to me at Dr. Smith, ElPasoSpineCenter.com. Thank you for watching. Tell your friends and neighbors to watch. Give us a thumbs up. And the most important thing, please subscribe. Thanks again.